Good afternoon, everyone. We're going to call this meeting of the Health and Human Services to order. We have one agency readout today, which is the Department of Human Services, Family Investment, and we have Ms. Tanya Zimmerman as our budget analyst.
Thank you. Starting on page 1 of the document, this shows the overall budget change, which decreases by $92 million to $2.4 billion. Moving ahead to page 7, this starts the discussion of the performance. However, if you turn to Exhibit 1 on page 8, this looks at the applications for the 3 largest benefit programs. The applications, a portion of applications each month are related to case closures. And so during the period where the recertifications were extended during COVID, there were lower applications. However, since that time, applications have been higher than during the COVID period. The SNAP applications are higher than they were pre-COVID. In December, they were about 18% higher than the pre-COVID period. The TCA applications are really kind of about where they were pre-COVID levels. However, the TDAP applications have risen substantially over the last few years. And in December 2025, they were 57% higher than they were pre-COVID. Turning to Exhibit 2 on page 9, this looks at application processing times, the average days to process applications each quarter. Generally, there's been improvement in the TDAP application processing times over the last couple of years, and the TCA applications are also kind of relatively steady. However, I'd note that the SNAP applications have increased over the last year, so that the average processing times are about 13 days in calendar 2025, compared to about 10 in calendar 2024. However, they remain much lower than the TDAP and TCA. Turning to Exhibit 3 on page 11, this looks at the application denial rates by the benefit types. Application denial rates are much higher for TCA and TDAP in all periods of this time. All 3 benefits experienced a spike in application denials in September 2025. TCA also had a smaller increase in July 2025, and these were generally the highest application denial rates through the whole period of data availability. And we've asked the department to discuss the cause of the higher denial rates in recent months and if there have been any changes to application processing that contributed to these increases. Turning to Exhibit 4 on page 13, this looks at, for the TDAP program, some of the primary causes of application denials. Through January 2025, they did not break out the denials that were related to disability, not meeting the disability criteria. Before that, they were captured as part of the no eligible members. If you look at those 2 combined, this is generally the leading cause in every month and are generally over 30% of denials. Moving ahead to turning ahead to Exhibit 5 on page 14. This looks at application denials for TCA applications due to non-cooperation with child support. Chapter 457 of 2020 changed the sanction policy for a non-cooperation with child support from full case closure to a reduction of benefit of 25%. The department is still able to deny applications for non-cooperation. And the denials related to non-cooperation really began to increase in calendar 2024, peaking at 21%. They have come down since that time, but at 6% in October, which is the most recent data, remain higher than in prior months. Moving ahead to Exhibit 7 on page 16. This looks at case closures by program per quarter. The SNAP case closures have generally been higher since April 2024. This largely has to do with the able-bodied adults without dependents work requirements, which were suspended during the public health emergency and didn't really begin to impact households until May of 2024. There have been spikes at various points for additional closures related to these as the Fiscal Responsibility Act of 2023 raised the upper age limit to 54 and jurisdiction level waivers expired during this summer. The TCA applications have generally increased related to a change in reporting. The TDAP case closures have increased in all but one quarter since April 2024, and the case closures in the most recently completed quarter exceeded 4,000, and that was the highest in the period. Moving ahead to page 20, this looks at some of the specific closure reasons that are specific to individual programs. The first looks at TCA case closures related to reaching the 5-year time limit. Federal law prohibits cases headed by an adult from receiving TANF-funded cash benefits for more than 5 cumulative years. However, the federal law provides for the option of exemptions to the time limit for hardship. Under that provision, states are allowed to have hardship exemptions of up to 20% of the caseload. And historically, DHS had granted the hardship exemptions to all cases reaching the time limit because they never reached the 20%, so few cases were closed due to this. There was an audit finding related to this in the October 2022 audit related to not documenting hardships but granting the extensions, and beginning in state fiscal 2024, the case closures related to this reason began to increase. And if you look at Exhibit 10 on page 21, this shows the impact of the case closures. The highest level of closures in 1 month was in December 2023. It was over 2,000 in that month, but has remained relatively high since then. In calendar 2025, about 255 cases closed per month due to reaching the time limit. And in total, since November 2023, about 9,700 cases have closed due to this reason. Exhibit 11 on page 22 looks at closures related to the TDAP caseload. TDAP has specific rules related to the disability and cooperating with SSI. Which are primary drivers of case closures. The closures related to being not totally disabled have exceeded 30% in 6 of the last 7 quarters and are the largest reason for the case closures. Turning ahead to page 24, this begins looking at some of the fiscal 2025 closeout issues. In the fiscal 2025 budget bill, there was language that restricted $5.8 million of general funds and $5.8 million of federal funds that were budgeted in the assistance payments program but intended to be used for administrative expenses for the Sunbucks program to be transferred to the director's office, as administrative expenses are not appropriate for that program. Under the language, funds not transferred were required to be reverted or canceled and not available for other purposes. During the fiscal 25 closeout, DHS failed to either transfer the funds or revert the general funds. And we've asked the department to discuss any changes to its processes to ensure that language in the budget bill restricting the use of funds for particular purposes is followed. The next issue related to the closeout addresses the fund splits in the various programs. The Family Investment Administrative programs are funded with a mix of general, special, and federal funds. The federal funds are from a variety of sources, though primarily from the SNAP Administrative Match, TANF, and Medicaid. SNAP Administrative Match and Medicaid generally have a 50% match, though there are some exceptions and some cases where third parties may pay the state share of the match. However, generally, they should be matched dollar for dollar. However, at closeout, as the fiscal 2025 closeout was reported, as you can see on Exhibit 13 on page 26, the expenditures in the local family investment program that were reported from SNAP and Medicaid far exceed the general funds that would be matching those. This is the most difference of any of the recent years. They're generally much more aligned with the 50% match that you would expect to see. And we've asked the department to comment on how it could have general fund expenditures of less than half the reported expenditures for federal SNAP administrative match and Medicaid when they require a 50-50 match, and also discuss how they'll ensure that actual expenditures in fiscal 26 and 27 better align with available federal matches. DLS notes that we also have similar concerns on other programs and in fiscal 2026 and 2027 as it's budgeted. Page 26 begins discussion of some of the ways that the federal government shutdown impacted SNAP and how funding was used in the department to assist households that were impacted by that. I'm just going to focus on some of the impacts discussed on page 28. Under the state of emergency, the governor provided the use of $62 million from the Fiscal Responsibility Fund for SNAP benefits. It was initially announced as providing full SNAP benefits. Ultimately, they were used to ensure that all households received at least 50% of their typical benefit. Under the federal payments that were ordered by the courts, they funded 65% of allotments, but it was recalculated how much you would actually receive. So some households received less than 50% of the benefits. Ultimately, the department used about 2.7 million of those before the shutdown ended and full benefits resumed. The Budget Reconciliation and Financing Act assumes the remainder of the funds are part of the transfer from the Fiscal Responsibility Fund to the general fund. And so DLS has recommended deleting the unused fiscal responsibility funds. DHS also issued a $50 benefit to recipients eligible for the supplemental benefit for seniors, reflecting the full minimum benefit under state law, which included what would be the typical state benefit as well as the federal share. DHS indicates that they anticipate being reimbursed for the extra benefits paid, and we've asked the department to comment on the status of that reimbursement. There was one legislative addition in fiscal 2026 in the Family Investment Administration. This was a grant to the Maryland Community Action Partnership. The grant agreement was still in development as of December 30th, and we've asked the department to provide an update on the status of that grant agreement. Page 29 begins the discussion of the proposed deficiency appropriations. These total about $32 million. The majority of this is general funds and is primarily related to the general funds that are needed to pay for the SNAP payment error rates, penalties related to federal fiscal 2023 and 2024. The penalties are under appeal. However, the funds will be available to support the amounts needed if the appeals are unsuccessful. The page provides a little more detail on all of the deficiency appropriations. I'm going to just focus in on one related to funding for the employment and income verification contract. That's about $11.7 million, including $8 million in federal funds and $3.8 million in general funds. The department indicated that this was an overstated amount, particularly related to the federal funds, and DLS recommended deleting the overstated federal fund amount. The next page looks at the cash assistance benefit levels. Under state law, the governor is required to provide funding to support a TCA benefit when combined with the federal SNAP benefit that equals 61.25% of the Maryland minimum living level. That's updated annually for inflation based on the May Consumer Price Index for all urban consumers, and the SNAP benefit levels are typically announced in August of each year. In mid-August 2025, USDA released the SNAP benefits to begin October 1, and the calculation of the May 2025 inflation change resulted in an increase in benefit levels for a 3-person household of $20 per month, and for a 1-person household, which is the basis for the TDAP program, an $8 increase. Historically, the calculation has been made in the advance of the start of the federal fiscal year so that it would coincide with the beginning of the SNAP benefit. In a break with historical practice in the last 2 years, the department has not calculated the benefit in advance and not made the benefit change until January 1. It's unclear why they've broken with this historical practice. In fall 2025, DHS seemed to indicate that the data wasn't, it did not have all of the information needed to complete the calculation. However, as previously noted, the SNAP benefit amounts were announced in August and the CPI-U data was available in the summer. For federal fiscal 2026, this delay was particularly concerning as the shutdown delayed full issuance of SNAP benefits, and a higher TCA and TDAP benefit could have provided additional assistance to some of those households. And we've asked the department to explain the rationale for not providing the required benefit increases until January, despite having calculated the benefit by mid-October. We also note that the delay is estimated to have resulted in reduced benefit payments of $1.16 million. Turning ahead to page 34, this looks at begins the look at the budget change. Most of the change is driven by one-time expenses or costs related to shutdown assistance. That results in about $72 million of the change. The assistance payments mostly align with the anticipated spending based on the caseload. The one notable item there is the EBT fraud replacement, which assumes savings from the implementation of new technology. And there's also significant decreases related to spending in the Maryland Office for Refugees and Asylees based on declining refugee admissions and changes in federal eligibility. Turning ahead to page 37, this shows recent caseload trends. The TCA caseload has generally declined over the last several years, and the year-to-date level of about 47,000 is below the level that is provided for in the budget. The SNAP supplemental benefit for seniors program shows a large spike in 1 month that relates to how they provided the assistance during the shutdown. Generally, the caseload for this program has also declined. The TDAP caseload has increased in nearly every month since June 2022 when it was at its lowest point in program history, and it's exceeded the pre-COVID levels for much of the time, and has exceeded 13,000 in each month since March 2025. At the current level of about 13,650, it has a higher caseload year to date than the budget currently supports. Looking ahead to Exhibit 19 on page 39, this provides information on the DLS forecast. Normally, we would provide a particular forecast based on whether we thought they were short or had surplus. The forecast this year has a lot of uncertainty. Some of that stems from the closeout errors that were discussed in the overview. Some of that has to do with the assumed savings related to the EBT fraud replacement. It assumes about 80% reduction in fraud beginning in the second quarter. That's based on the experience of only one state that's implemented the technology, so it's uncertain how that will actually play out. And they have received recently federal reimbursement for cases under the TDAP program for cases whose applications for SSI or SSDI have been approved. This has been much higher than historical levels, and it's unclear whether the federal government is just working through some prior backlogs or whether but there are improved processes that are resulting in these higher levels, and they'll be sustainable. The $10 million that were reported as having been received in fiscal 2025 far exceed the typical $3 to $4 million that had been received in the prior few years, and they had reported receipt of more than $7 million only twice dating back to 2002 before that, and that's periods when the caseloads were considerably higher. As a result, we presented a range in our forecast. If the assumptions play out as they are budgeted, DLS anticipates that the budget is relatively adequately funded. However, if some of these assumptions don't play out, there would be potential shortfalls of over $12 million in fiscal 26 or $32 million in fiscal 2027. Turning ahead to page 40, this looks at the SNAP caseloads and recipients, which have generally declined. The fiscal 2027 allowance includes $1.66 billion for the SNAP benefit payments, which exceed the funding level in fiscal or the actual benefit amounts in fiscal 2025 of about $1.49 billion. The caseload was higher during then, and so DLS anticipates that the $1.66 billion will not be needed, especially as caseload and benefit changes are expected under the One Big Beautiful Bill Act. And DLS recommends reducing SNAP funding by $200 million to better align with the fiscal 2025 experience. Looking ahead to the first issue, this looks at the impact of the One Big Beautiful Bill Act. I know you've had briefings on this program, so I'm just going to highlight a couple areas. DHS and MDH have indicated in various briefings that they are collaborating to reduce the impact of the changes on recipients. The text provides some examples of those efforts to coordinate and collaborate and reduce the impact, and we've asked the department to discuss their partnership and collaboration with the Department of Health and other agencies to reduce the impact of OBA changes on customers. Looking at page 47, Exhibit 22, this looks at case closures related to ABODs. This is all before any of the impacts of the changes on the ABOD program to under OBA. However, it provides some history of what has happened since they reinstituted these requirements with closures beginning in May 2024. Generally, there have been spikes in closures in months where those took effect when the upper age limits occurred under the Fiscal Responsibility Act, and a large spike in September 2025 when the waivers ended related to the end of waivers in several jurisdictions, including Baltimore City. The OBA changes would impact a little bit differently because they are implementing them based on when people recertify, but we would expect to begin to see those impacts in March 2026. Based on the data provided by DHS, about 30% of cases whose cases has closed due to the requirements between May 2024 and July 2025 had reopened during that period. The fiscal 2027 budget includes about $43 million of additional general funds in the local family investment program to reflect the higher state costs due to the SNAP administrative match change that takes effect October 1, 2026 under OBA. It's uncertain if this is the correct amount of funding due to some of the inconsistencies in the reporting of the SNAP administrative match discussed earlier. While the budget provided the additional general funds, the federal funds of an equivalent amount were not reduced, and DLS recommends deleting those funds. The department also has the funds budgeted in a singular program, and we've asked the department to discuss the process by which those will be allocated and when that will occur. Exhibit 24 on page 52 provides information on the DLS forecast of the impact of the benefit cost share that begins in fiscal 2028. This assumes that the other impacts of OBA have reduced the caseload and reduced the benefit levels of households. It also assumes that the department's cost share is at the highest level based on the payment error rate. As you can see in this exhibit, DLS forecasts costs of about $144 million in fiscal 2028, exceeding $200 million by fiscal 2030. OBA also repealed the Nutrition Education and Obesity Prevention Grant Program after federal fiscal 2025. Despite this, the fiscal 2027 allowance continues to fund the program at $9.2 million, and DLS recommends deleting the funding since the program has been repealed. The final issue in this analysis relates to the voluntary settlement agreement that was entered into in October 2024 related to disability-related activities and issues. The Office of Civil Rights and the Department of Health and Human Services found systemic concerns related to a lack of consistent approach for assessing disabilities and related modifications or accommodations for customers to participate in and meet program requirements, and a need for statewide policies and procedures related to providing reasonable modifications and accommodations, as well as staff training, among other things. The settlement agreement required a number of different actions by the department based on timelines from the effective date of the agreement, which was August 2024. The department submitted a report that was required and indicated that in September 2025, the Office of Civil Rights had granted the department a 6-month extension on all of the deadlines. Under the terms of the agreement, if the department fails to substantially comply with the provision, OCR could terminate the agreement and take additional measures, including reopening the investigations that spurred the agreement, as well as other enforcement procedures. Of the 10 provisions with deadlines that had passed by the date of the report, they had completed 8. 2 were in progress. They related to the assessment tool. The assessment tool is used to determine a customer's strengths and weaknesses, educational level, work history, job skills, and readiness, as well as disability status. Of the 3 deadlines related to the assessment tool that had passed prior to the submission, they completed the one which was to identify the assessment tool, but had not yet met the deadlines related to proposing policy revisions and implementing the assessment tool. And we've asked the department to comment on how it's working with the OCR to ensure that it's not deemed non-compliant for meeting the deadlines. Turning to page 56, this begins the recommended actions. I'm just going to highlight the ones that I haven't already mentioned as part of my presentation. Recommendation 2 is to delete funds that were budgeted to be used to implement departmental legislation that has been withdrawn. Turning to page 57, recommendation 5 is annual language recommending requesting quarterly reports on application processing times, denial rates, and case closures. Recommendation 6 on page 58 restricts funds pending a report on the calculation of the Maryland minimum living level, the date for which benefit increases are effective, and an explanation for a date beyond October 1. Recommendation 7 is annual language restricting funds for the assistance payments program to that purpose. Recommendation 8 is narrative requesting information on the Sunbucks participation administration and expressing intent that they budget the funds in the planned area of expenditure. And the remainder of the recommendations have already been discussed. The remainder of the analysis includes updates on employment and training programs and activity, as well as information from the Life After Welfare Report. And that concludes my presentation.
Thank you, Ms. Zimmerman. Seeing no questions from the committee, at this time, we'd like to bring up the respective agency.
Good afternoon, Chair McCray, members of the committee. I'm Gloria Brown Burnett, Interim Secretary for the Maryland Department of Human Services. I would like to first thank the Governor and the Department of Budget and Management, as well as Tanya Zimmerman, our DLS analyst, for her assistance and analysis of the FIA budget, Family Investment Budget. I want to acknowledge the DHS leadership team here with me today. To my far right is Augustine, I can never say your name.
Navanganimana.
Executive Director of the Family Investment Administration, or FIA, Chief Financial Officer Roman Napoli, and Chief of Staff Webster Yee. And in the audience joining us today, Hartford County Director of Social Services, Cora Grishkot. Also here are key senior leaders from the Family Investment Administration and from across DHS are also here present with us today. I will keep my remarks brief. And when we have included more detail on our accomplishments and priorities in our written testimony. Our vision for Maryland is one where all children and vulnerable adults are safe, children have permanent homes, and families thrive. When we began the hard work of realizing this vision 3 years ago, we knew we had to rebuild trust and modernize a system that had fallen behind. Since 2023, the Family Investment Administration has been focused on making much-needed, long overdue changes to provide Maryland families with tools and resources they need to thrive. Today, we can report that this progress is delivering results and continues in several critical areas for 2026. Making benefits more secure and easier to access for Marylanders through new chipped EBT cards coming this summer. Minimizing harm and preserving access to lawful benefits as we implement H.R. 1 of 2025 with SNAP now and with Medicaid later this year. Continuing to increase access to benefits for Marylanders who are eligible and making meaningful reforms that continue to bring down Maryland's SNAP payment error rate. We have previously provided a briefing in detail to the committee, as was referenced earlier, on the impact of H.R. 1 on Marylanders, and those slides are attached to our written testimony for your reference. We've made some meaningful progress, but hard work remains. As we look ahead, we are reinforcing our strategic pillars of benefits, access, and economic stability by investing in people, practice, and policies that deliver our vision for Maryland, that of ending childhood poverty. I want to also acknowledge that DHS is in the midst of a transition, as is evidenced by me. We are committed to building on what's working and improving where we need to make improvements, improving on what we need to better serve Marylanders. My commitment to you through this transition and beyond is that we will get better every day and deliver for our families, the families that we serve. I will now turn it over to Roman Napoli, our Chief Financial Officer.
Thank you. I'll be going through our responses to the various items identified in the DLS analysis. On the first prompt on page 11, to discuss the cause of higher denial rates in recent months and whether any changes to application processing have contributed to these increases. Based on our review to date, there is no direct cause for the higher denial rates. We are further reviewing to see what changes to either the application process, federal rules changes, or broader economic conditions might have contributed to this increase. Additional information is provided in our written response and in the linked JCR for August through October 2025. On ensuring that any budget language restricting the use of Sunbuck's administrative funds is followed on page 24. Our finance office, which is myself and my team, made an administrative oversight in 2025 Sunbuck's administrative funding, and we provided a written response to DLS on this oversight in December. Me and my team will be increasing our tracking of JCR language coming out of the legislative session in a more robust manner going forward. We were asked to comment on SNAP general fund expenditures on page 25 and how they did not appear to match the dollar-for-dollar SNAP admin requirement. When we received the DLS analysis last week, we took the opportunity to revalidate our matching funding and identified the matching amount through the aggregation of all sources of SNAP administrative funding, not just those that were identified in the analysis. Our math shows dollar-for-dollar match, which is what we will report to the federal government as we work with them to close out our 2025 report. On page 28, we were asked to comment on the status of the reimbursement of $2.6 million in state funds used for SNAP benefits during the federal shutdown, and to delete any unused federal fiscal responsibility funds. We concur with the DLS recommendation to delete the unused fiscal responsibility funds. We have not received any formal guidance, though, from USDA on how to submit for reimbursement of these state-issued SNAP benefits. USDA is required by federal law to reimburse Maryland, and we will pursue every option until the federal government reimburses these state funds. On page 29, we're asked to provide an update on the status of the 2026 budget language for the Maryland Community Action Partnership. We received the award agreement on February 17th and executed the grant agreement on February 20th. We are now engaged with MCAP on program implementation and the funds necessary to do that. On page 29, DLS has also recommended deleting an overstated federal portion of our SNAP employment and income verification contract. We respectfully do not concur. This critical contract is used to verify income for various programs such as SNAP, temporary cash assistance, and the home energy programs. The risk of not having adequate funding is that we could be forced to stop income checks for applicants, which would inevitably increase the SNAP payment error rate. We originally misidentified the use of these funds in our earlier discussions with DLS, but we have spoken to them and attempted to correct the record so that it is clear these funds are needed. On page 31, we were asked to provide the rationale for not providing the required benefit increases until January of each year, despite having calculated minimum living level benefit increases. We plan for the January 1st start date because the upstream inputs and approvals required to set accurate benefit levels are not reliably available early enough to support an October 1 rollout. In prior years, these timing constraints frequently cause us to miss the October 1 implementation date, requiring retroactive benefit adjustments that increased in administrative workload, complicated system operations, and created confusion for clients. Maintaining a January 1 implementation date avoids these recurring issues, ensures benefit changes are implemented accurately, predictably, and on time, supporting sound financial management and operational stability. On the DLS recommendation on page 40 to reduce SNAP funding by $200 million, we respectfully do not concur with this recommendation and instead support the governor's budget. In this time of economic and federal government uncertainty, we do not recommend that federal funding flexibility be reduced. On page 43, we concur with DLS's recommendations on Sunbuck's program report and the restricted budget language. Page 46, we were asked to discuss our collaboration and partnership with MDH and others to reduce HR 1 changes. We have been working closely with Health and the Health Benefit Exchange to reduce administrative burden and maintain lawful benefit access. We have provided separate briefings to the Budget Committee on this subject and are happy to discuss further opportunities for partnership. On page 49, we concur with DLS's recommendation on the federal funds. We have asked to discuss the process of general funds that will be allocated to the appropriate programs on page 49 as it relates to SNAP administrative funds. Currently, DHS only has a manual cost allocation tools for this purpose until statewide systems become available. We make every effort to ensure costs are properly accounted across every relevant cost center that SNAP admin should be charged against. We are providing increased oversight from DH Finance leadership, which is myself and my team, and additional SNAP-related programs are not subject, and noting that additional SNAP-related programs are not subject to the cost-sharing changes, namely Sunbucks or SNAP ENT. Page 52, we concur with the DLS recommendation. On page 54 of the analysis, we're asked to comment on our work with the U.S. Department of Health and Human Services, Office of Civil Rights. On September 17, 2025, the Office of Civil Rights provided us with written confirmation that we are in good standing with the Voluntary Resolution Agreement. We continue to hold monthly check-ins and engagement to remain on track to complete the remaining VRA activities. On page 6, in response to DLS's operating recommended budget actions. On number 1, we concur with the first budget action to delete the funding. On 2, we concur. We respectfully do not concur on the third recommendation related to $200 million in federal funds for SNAP. We concur with the 4th recommended action to reduce the equivalent funding. We concur with the next item for quarterly reports on our benefits data. On the 6th recommended action for a report on the calculation of the Maryland minimum living level, we concur with the report request, but ask for a due date of December 1st. This date will allow us to make sure that our calculations are fully accurate and the data that supports it is not usually available until October 1st. We concur with the 7th recommended action for a budget restriction on OA assistance payments. We concur with the 8th recommended item for a Sunbucks report, but we request the report deadline of July 1st, 2027. January 1st, 2027, to better align with the time needed to reconcile fiscal data and performance measures. Sunbucks continues to be reconciled through December, and we wish to align our federal and state submissions accordingly. We respectfully do not concur on the 9th budget action to reduce funding for the employment and income verification contract for the reasons we previously stated. And lastly, we concur with the 10th recommended budget action to reduce unneeded fiscal responsibility funds in 2026. And with that, we're happy to take any questions.
Senator Jen.
Thank you. So my question is on the last recommendation, which you guys do not concur with, which was the employment income verification contract. Any idea why you think they DLS wants you, they don't want that? Because to me, that's going to eliminate fraud. Because I know we've heard across the country of fraud for this, because to me, that's how, when somebody's saying that, hey, I only make $10,000, that you're using that to verify their income. Is that correct?
That's correct. So the income verification contract is relied upon to access income, wage data from Equifax, which is again used to determine eligibility. Without access to that system, we risk increasing the payment error rate. So that's why we want to maintain a robust budget.
You want to keep that?
That's correct.
Okay. Any idea why DLS might want to?
Oh, yeah, I'm happy to speak to that. When we presented the budget, we asked for additional resources for the contract to make sure we had what we needed in '26. When the review was done, the analysis was done, it appeared as if those funds were not in the right allocation by amount across general funds, special funds, and federal funds. That was our mistake. We've shared that we think that was a mistake and that we did actually need the funds because the contract often goes over its initially contracted amount.
Okay.
So we think it is important to maintain.
Okay. Thank you, Mr. Chair.
Senator Augustine.
Thank you. I just didn't necessarily, because we don't have like the details and stuff like that, but the impact of the federal changes are incorporated into the 2027 allowance, or they are not?
So if you're talking about the budget, that's correct. So the increased cost sharing on the states from 50% to 75% is going to be effective October 1st, and that our budget reflects that change.
Okay, so the budget does reflect
Yes.
that change.
That's correct.
And when do we expect some of the challenges where some folks could fall off of the benefits? When do we expect to see that, and has that been incorporated as well?
So some of the HR1 changes have already started to take effect. For instance, refugees and asylees who are no longer eligible for SNAP benefits until they become legal permanent residents, they're being impacted right now. So in terms of work changes, those changes were effective in November. However, customers have about a 3-month grace period to comply with the work requirements. We do not anticipate starting to see impact case closures of ABODs until next month in March. So starting in March, we might start seeing people falling off for not complying with work requirements.
Okay, I understand that. So what I'm asking is that reflected in the 27 budget, though? What you are expecting is going to occur, instead of just year over year, assuming basically based off of previous year. Are you following what I'm asking?
Yes, Senator, and if I could just take that, we estimated that up to 80,000 of our 680,000 customers could be affected. And the answer is yes, we have adjusted for that in our budget planning assumptions. However, the exact impact won't be known until we figure out exactly what it is. So there is a degree of uncertainty here, but again, we're planning and we're working with all of our technical and
Okay,
budget
and
teams.
that's what I was asking.
Yes, sir.
So when you did that, did you make the assumption that they would lose the benefit, or did you make the assumption that they would not lose the benefit?
The target category is up to 80,000, and so we're working with that assumption. Yes, sir.
They would lose the benefit.
That
Okay,
they
but the
could lose that
budget assumes that they are keeping the benefit.
If I might jump in, that's correct. The budget assumes that they're going to keep benefits because, again, first of all, we're trying to do everything that we can to prevent people from losing benefits. So, we have expanded our work programs. We are collaborating with the Maryland Workforce Association, working with the Governor's Workforce Development Board to mobilize robust employment training resources to support those individuals so that they do not have to lose benefits. Are people going to some people ultimately going to lose benefits? Yes. Can we predict how many? No, because again, we're not going to be able to know that until people start losing benefits, and we can much more predict what those numbers are going to look like moving forward.
And Senator, if I could try to address your question, I think, like, if you're saying, hey, have we taken 80,000 people and just say, we're going to cut that off of our budget top line, we have not done that, sir.
Right, and I was understanding that. So, and I understand the impact on the federal dollars, but I am, not for now, but I am wanting to know what the potential impact on state dollars would be. If we could just better understand that. I'm not asking for the answer to it now, because, I'm not.
Yep.
If y'all could come back with that, I would be grateful for that. The next question that I do have, Mr. Chair, is that okay? Okay. The next question that I do have, though, is on the implementation of the benefits portal, right? And how many folks are coming through the benefits portal versus like paper at this point?
Yeah. About 70% of applicants apply through the One App. And about 40% of people renewing benefits come through the One App. Now, we are working with our communications office and Maryland Benefits to increase online applications because, we think it's in the best interest of the customers, but it also does reduce the administrative burden on our workers.
Okay, and so what I would like to know is also like the reject rate from the paper versus the reject rate from the online, and how we're trying, what we're doing to help people to move to the the online, and that the impact that we would expect, and well, let me ask that as a question, how we, because it will also have a issue, it'll do something on the errors as well, right? I mean, so how that has been incorporated into the budget for next year. And again, also sort of like offline, how that works now that it's been moved to do it, and the relationship between the two of you if you see issues, problems, or concerns. And again, I'm just asking for, not here, but.
Senator, we'll be happy to get back to you in writing and to work with you offline to work on the exact parameters. And then with respect to the partnership, as Secretary Brown Burnett mentioned last time at our admin hearing, it's a really extraordinarily close partnership. We're working with them every day.
Okay, thank you.
Just a couple questions, and first I want to say that I appreciate my colleagues' line of questions because I was thinking the same thing around the state's assumed costs when it's shifting from the feds to the state. I know that Ms. Zimmerman stated that obviously we get monthly reports around the closures and things of that nature, but thinking through what does FY27 going into 28 look like is of concern to the respective committee. Madam Secretary, just a couple questions and more or less just information that we'll try to get from the agency. One of them is when we think about the error rate, I appreciate that you all have dropped it from the 30s to, I believe, 13%. We're trying to get it under 10% to ensure that the penalties Art always concerned. Can we just get a timeline? Can we get some benchmarks in reference to when the respective agency plans to trigger to get to that 10% below would be helpful. You can comment or you can get us the information.
I'm going to defer that to Augustine.
Yeah, thank you for the question, Mr. Chair. Yeah, we have mobilized a lot of resources to continue our efforts to reduce the payment error rate. We are working with companies like Code for America to redesign the renewal application, for instance, because we believe that the more we can get people to enter information online, it's going to reduce the burden on the worker, which will allow them more time to focus on the more complex cases. We are working with an organization called the U.S. Digital Response to analyze data and identify sort of the pain points, so to speak, and then we're going to use that information to revamp our internal processes to continue to help mitigate the risks of errors. Training, we're investing in a lot of resources in staff training and a lot of initiatives around that. So we are with you in that we want to drive that payment error rate down to the maximum possible.
Yep, and I believe you did. Some of the stuff you said is like more day-to-day, and we're looking at the long-term approach from an oversight standpoint. So, Madam Secretary, if you could just help us understand, what are the goals? What is the triggers? What's the timeline in which we get the 10%?
We would be happy to follow up with you in writing.
Yes, ma'am. And the second one is another one that probably suggested follow-up in writing, is when we speak to the denial rates. When I looked at the denial rates and when I looked at the response, it was kind of like, it's happening or wasn't specificity. So if you could just help us and get this information to Ms. Zimmerman too, like year over year, in reference to like these high denial rates that we have, are they denied because of income? Are they denied because of work requirements, non-compliance with information? Like that would be helpful for us to get a better understanding of like, why is it such high denial rates? I think September was one of the months that was mentioned and things of that nature. And like I said, just of interest to the question that Senator Augustine has, it almost feels like some level of deficiency may come in at some point in time, but I appreciate, I believe, Mr. Chief of Staff, when you talked about uncertainty, that's okay because these are new waves, new waters that we're going into right now.
Absolutely. And I would add also with the rollout of the online tool and people being able to screen whether or not they're potentially eligible, I think it has encouraged more people to at least go online and fill out the application. So they may think they're going to be eligible, but then after they're asked to comply with several things, they find out that they're not. But we will definitely follow up in writing.
Yeah. And colleagues, seeing no questions at this time for the agency, we're going to move into the public testimony, if we can, Madam Secretary. And at this time, if we have Ms. Shanae Parker, Anthony Stone, and Pamela Richardson come to the mic.
What order you want us to go into? Okay, all right, I'll go first. Thank you, Senator McCray and members of this committee. My name is Pam Richardson, and I've been with a state employee for 13 years, and I'm a proud member of AFSCME Local 112. I want to start with a simple truth. The sunk cost fallacy preserves a false identity. The belief that we can continue operating the same way while workloads grow and staffing declines. I feel this reality every day as I serve my families accurately while managing an ever-growing caseload. The work at Family Investment Administration is complex and critical. Staff determine eligibility for multiple programs, ensure compliance with federal and state regulations, maintain accuracy, and serve families in crises, all while navigating all the updates, the HR 1 policy changes, detailed eligibility processes. I've seen it firsthand, how burnout and turnover affect both our work and the families we serve. The staffing shortages make this work even harder. Vacant positions do not reduce the workload. The work is redistributed. Caseloads increase, timelines shrink. Staff are expected to meet productivity and accuracy standards at the same time. Burnout rises, turnover rises, mistakes do happen, and the families feel the impact. Automation helps streamline process like the mid-certification Maryland benefit review forms. It cannot replace professional judgment or accountability. That proposed ICE facility in Hyattsville, 6505 Bellcrest Road, that's my office. That adds another concern, because that office has a lot of undocumented immigrants. Community trust matters. If we are serious about stabilizing the workforce, reducing turnover, and protecting program integrity, we must address compensation. Competitive and equity raises are not just about pay, it's about retention and recruitment, and sustaining a workforce capable of meeting the demands placed upon it. Investing in fair compensation, investing in Maryland families, and in the long-term strength of this agency. Thank you for your time.
Good afternoon, everyone.
Good afternoon.
My name is Shanae Parker. I'm a family investment specialist at Northeastern District. I've been a state employee for 26 years, and I'm an executive vice president of Local 112. Invest in us, state employees, not outsiders. Seriously, most of us are one paycheck away from needing the benefits we process. The state should pay decent salaries instead of dumping money and resources into those contractual companies such as wasteful call centers that don't serve its purpose, and security contracts that, by the way, has increased more than 30%. Our customers inform us on a daily basis that the contractual call centers direct them to come to the office to resolve their issues. Some of the tech issues, the eligibility and enrollment system now auto-processes Maryland benefit reviews if customers report no change, as long as they submit it online. Starting with the March 2026 Maryland benefit review form, paper ones will have a QR code at the bottom. Our website isn't the easiest to use, which is why people line up across the parking lot daily just to relying on us to help out. We understand the transformation in technology and the importance of innovation of technology, but people need us for essential services. It cannot replace us. Our community members are dealing with serious life-changing things. They need to talk one-on-one with a trained specialist. Just relying on AI technology will leave the most vulnerable people who depend on our expertise out in the cold. That personal contact builds trust and help us to understand unique situations, avoiding high error rates. Just relying on tech will leave the most vulnerable people out in the cold, like I said. Our jobs are essential and they require a ton of integrity, skills, efficiency, and most importantly, our customers are relying on us. Thank you.
Good afternoon, Mr. Chair. My name is Anthony Stone, and I'm a member of the Consumer Relations Committee of Healthcare for the Homeless. I am here to support full funding of TDAP in this budget. I want to share my story, which shows both sides, is how TDAP helped me and then what happened to my life when I no longer had it. I started getting TDAP in 2023. Before that, I had been working and liked my job, but when my health conditions got worse in 2023, my doctor said I could no longer work with my disability. I had no other way to have income. So it was a relief when I got TDAP. It helped me pay my BG&E transportation. Before that, it was $80 well, transportation before that was $80 a month for MTA. Helped me with clothes and more. It wasn't enough to live, but it was at least something because I couldn't receive any other income because I couldn't work. In 2024, going against my doctor's recommendations, they took away my TDAP. This was devastating to my life. After stopping my TDAP, I had an income. I knew my health would get worse, but I also needed some income to live and pay my bills. I have previously worked events at a hotel, setting up and being a food runner for their banquets. Given that I had few options and I needed income as soon as possible, I went back to this job. I have a disability and I was working on a bad foot. Because I had to stay on my feet for this job, I got an ulcer under my toe, and then this past October, I got an infection in my foot. I had to stay at the hospital for 2 weeks, then go through physical therapy. Another one of my, I just want to thank y'all. All right. Say it again. Oh, I can finish? Okay, where was that? Okay, given that I had after stopping my Tdap, I had no income. I knew my health would get worse, but I also needed some income to live and pay my bills. I had previously worked events at a hotel, setting up and being a food runner for their banquets. Given that I had few options and I needed some income as soon as possible, I went back to this job. I have diabetes and I was working on a bad foot. Because I had to stay on my feet for that job, I got an ulcer under my toe, and then the past October of 2025, I got an infection of my foot. I had to stay at the hospital for 2 weeks, then go through physical therapy. Another one of my health conditions was a torn rotator cuff. The pain and injury also got exacerbated from work. Now I can't even walk 2 blocks because my feet start hurting, all because my condition got worse from losing the Tdap income and being forced to work. It got so bad that I had to stop my job, still without Tdap again. It wasn't a lot, but it's something to help me live. I needed full-time work to help pay bills that Tdap was helping me pay. I like working, I want to work, but for me and many like me, our health makes us unable to work. For us, Tdap is a lifeline to allow us some income. I just want to illustrate what it means when someone does not receive Tdap they need. I believe Tdap helped me live and keep my health under control. For me and others in my situation, it is important that this life-saving program remains fully funded in the budget.
Thank you, Vice President Parker and Ms. Richardson. Just want to say thank you for your leadership. Thank you for what you do for folks across the state of Maryland, but more importantly, workers that may not always be able to join us at this moment, just lifting up their voices. And Mr. Stone, just want to say thank you for your personal story in reference to the importance of the services that are offered from that standpoint. Colleagues,
You're welcome.
Yes, sir. Colleagues, we do have 3 more witnesses at this time. I'd like to call up Ms. Callie Schumitz, Michelle Medeo, and Lisa Klingenmeyer.
Thank you, Mr. Chair and members of the committee. My name is Lisa Klingenmeyer. I'm here today representing Maryland Family Network. We're here today in strong support of the Department of Human Services and the programs of the Family Investment Administration and their budgets. I want to particularly talk about the Temporary Cash Assistance Program. This is the cash benefit program for children and their caretakers. I did the math. This is my 15th legislative session testifying before you all and on this budget. And over those 15 years, we've made some great strides in trying to improve the Temporary Cash Assistance Program. Sadly, there are some things that remain stagnant in the program, and as the DLS analysis points out, there are some things that are troubling about the program. What's remained stagnant is that when we take temporary cash assistance and combine it with SNAP, it reaches 61.25% of the Maryland minimum living level. So we figured out what it takes to minimally live in Maryland, and we are still 15 years later and even longer than that asking families to live at less than 2/3 of what it takes to minimally live in this state. Those programs are vital. TDAP is tied to the caseload of 1 for TCA, so as Tony's story goes, these programs are vital, but we still have families living in deep poverty on these programs. What is troubling is that it seems to also be an increased challenge for people to access temporary cash assistance right now. There are troubling trends in looking at the caseload denials and looking at people not getting waivers that they should be getting, and then also the benefits not being increased on time. We already ask families to live at so little income, and never before has that not been increased on time. So we find it exceptionally troubling that we're now waiting until January to increase those benefits, when, again, they're living on so little income. There's a myriad of ways that we are urging you all to help us support the families who live on temporary cash assistance, the families who utilize the programs of the Family Investment Administration, to work with us and the department in making sure that families have access to these programs, and in any way we can increase the benefit levels. Thank you all so much for your support, and thank you.
Good afternoon, Mr. Chair, members of the committee. My name is Michelle Medeo. I'm an attorney with the Public Justice Center in the Health and Benefits Equity Project, where we advocate to protect and expand access to health care and the social safety net services we're talking about today. We also represent individuals and families in appeals when they're unlawfully denied or terminated from these benefit programs. So we come today in strong support of these programs and continued funding as requested by the department. I wanted to just flag for you that in your packets, there's very compelling written testimony by Ms. Taylor, who's not able to be here today, but shares her family's experience receiving TCA while she was experiencing a crisis. She shares how important that benefit is, and as Lisa mentions, how the benefit falls short of meeting basic needs with the rising costs of rent and food. I wanted to focus my testimony today on the alarming increase in denial rates for TCA and TDAP, and the very stark increase in TCA closures due to the hardship exemption and or the time limit and folks not getting the hardship exemption. So I was alarmed to read that the denial rates for these programs has consistently exceeded 70% and gotten as high as 92%. That's more than 9 out of 10 people who walk through the doors of DSS getting denied. And it's not easy to apply. As the department colleague mentioned, people wait all day outside and inside. So these are folks who are eligible for these programs who are getting denied. And I know from representing people in appeals, it can be several months when you're reapplying or having to go in front of an administrative law judge just to get connected to the benefit. I talk about in my written testimony a couple examples, but I worked with a family who was fleeing domestic violence in a shelter, provided the department with documentation that she was residing at the shelter, and her TCA was cut. And it wasn't until we represented her in an appeal in the morning of the hearing before a judge that the department agreed to reinstate her TCA. So it should not be this hard to access these very critical anti-poverty programs. We're concerned the department has no reason today for the increase, and we look forward to figuring out how we could get those down. Thank you.
I didn't get you. Usually I look for favorable with amendment, or I look for unfavorable. So I'll take a look, and if there are questions that we should be asking of the agency, please share.
Yes, thank you.
Thank you, Chair McCray, members of the committee. My name is Callie Shumatz with the Maryland Center on Economic Policy. So the basic income support programs that the Family Investment Administration oversees provide a really essential floor of support for Marylanders who are facing severe economic hardship. So our testimony is put in as favorable because we do support the funding of the programs, but we do want to make sure that these programs are accessible, adequately funded, because when they work, they can reduce poverty, stabilize families, and they circulate money back into our local economies. Our written testimony touches on a broad range of issues, but I just want to highlight a couple things. First, as DHS continues to implement the changes to SNAP that are required by H.R. 1, we strongly support ensuring that there are sufficient funds for the staffing and technology updates needed to prevent people from losing their food assistance due to administrative barriers. There's also legislation we're supporting that's introduced in the House only that would create a state-funded program to provide food assistance for the refugees and asylees who are no longer eligible for SNAP under HR 1, and we would like to see that included in the budget. Regarding TCA, as we have shared in the past, we remain concerned about the significant amount of TANF funds that go to child welfare, foster care, and adult services. While those are also necessary programs, they are not core functions of the TANF program. We would really like to see more of the TANF funds going to cash assistance for kids and their families. Definitely echo the comments of the prior two speakers, that while TCA benefits do go up slightly year to year, they're still falling short of an amount that is truly what families need to stabilize and afford the basics. So we believe there are opportunities to adjust policies and maybe explore innovative programs like RX Kids in Michigan that can really expand the reach and impact of our limited TANF funds. Thank you.
I'm gonna go back to the Public Justice Center. So we asked the agency of like the categories. I agree, like when you see denial rates that's triggering that how something's going on. So, but these ones that the two examples, they're like one-off. So like they're, I'm glad that folks got to receive the benefits because they should have. But I'm not assuming that everybody's running from domestic violence or things like that. Do you see anything that's triggering that we should be paying attention to that seems off? That's why I was asking for what are the categories from that standpoint.
Thank you for the question. And I would like to see the categories as well. I think with TCA, I noticed in the DLS analysis that over a 2-year period, close to 10,000, I think it was 9,700 TCA case closed for the time limit reason. So that's one of many closure codes, but that seems alarmingly high. And I know it sounds like, there was a focus because it was highlighted in an audit, but the general rule and regulations is you can receive TCA for up to 60 months. But beyond that, the Department of Human Services can grant what's called a hardship exemption, so you can continue to receive TCA beyond that. So it does seem concerning that such a high number of cases closed in 2 years. And so the example I gave of the family whose TCA closed and it wasn't until the hearing, she should have been granted a hardship. Her case should never have closed out. So I would imagine there's probably a lot of families who do qualify for a hardship exemption, and in her case, there was no analysis or assessment. There was no screening or assessment or questioning done prior to closing her case. Her case was just closed. The other thing is with the time limit, some months count towards the time limit and some months don't count. And in her case, and I've seen this in other cases too, the department just looks at how many months you've received TCA without determining are those countable months towards the time limit or are they not. And one example of a month that wouldn't count is if you're fleeing domestic violence and in counseling, that month should not count if you receive TCA. So that's just one example. With the TDAP denials, a very common reason I've seen is questions with the form. So I noticed in the DLS analysis, there was a common reason of folks not being disabled and being denied because they're not disabled. And in my experience working with individuals applying for TDAP, they are disabled. They're given that closure code or denial code when there's a required form for their provider to fill out. Another example I gave in my written testimony was client whose their provider did complete the required department form and in addition wrote a letter confirming this client had a disability. It stated what the disability was. They were the treating psychotherapist and the disability was expected to last at least 3 months. In this client's case, because the provider wrote estimated 3 months but didn't give an end date, the case got denied. Again, that had to go to appeal. We had to get a decision from a judge. Client won, but it was several months of fighting. So these are just a couple examples, but I think folks are eligible for these programs, and I'd also be happy to follow up with the committee with some more information too.
All right, I just want to say I appreciate all of you all's leadership and just the advocacy that you're doing on behalf of Marylanders. Ms. Zimmerman, just thank you for helping us see it a lot more clear. And Madam Secretary, just thank you and look forward to some of the follow-up items that we requested. Colleagues, seeing that this was our only agency readout, look forward to seeing you all tomorrow. It will be a lot longer than today. Thank you.
Thank you.